It sure is a wonderful world, but I am a nurse, and if the world was my patient, I'd say planet Earth is in multi-system failure. We are living in a major public health crisis that affects every part of our lives, from the air we breathe to the food we eat, and that crisis is climate change. Caring for planet Earth and caring for our health are the same. We cannot be a healthy person in an unhealthy planet. So let's imagine a 60-year-old living with chronic illness today. They likely have trouble going up and down the stairs and doing some basic tasks, but they're able to go outside and enjoy the outdoors and have their family and friends over for the weekend. Now let's imagine that person in 2040, 80 years old, hopefully, still with chronic illness. But life in 2040 is totally different, will be totally different than life in 2021 if things do not change. Our 80-year-old will go out for their daily walk, and the heat will slowly wear them down. Their 1-hour walk will quickly turn into a 10-minute walk because the heat has become so unbearable. When they go to take a deep breath, it's difficult for them to take the deep breath without coughing due to traffic emissions and harmful particulate matter due to the increased number of cars on the road. Because in 2040, we continue to build our communities around the automobile. However, our 80-year-old doesn't drive, so that just adds to their feeling of isolation. More people are generally unhappy because they can't go outdoors, interact with friends and family due to the risk of heat stroke. When they reach for a snack, it's less likely to be a fruit or a vegetable due to the reduced crop production. Now imagine that was your mother, your father, your aunt, your uncle, a loved one, because that very well can be their story, and it could be your story too if nothing changes. Now let's take a step back and let's look at our 60-year-old. So rewind, look at our 60-year-old who still has chronic diseases, but in 2040, by the time of 2040, we have come together to look at their life differently. So that person that is 80 years old in 2040 can still go about their daily activities because we have all made changes to what's happening in the world and impacted climate change. So let's imagine our 80-year-old still has chronic disease, but we have made fundamental changes to make the earth healthier. And because we have made the earth healthier, we're able to make people healthy within that time, regardless of their race, ethnicity, or socioeconomic status. We have prioritized trees, sustainable agriculture, and green energy. Our 80-year-old friend goes out for their daily walks among tree-lined streets, and they're able to play with their grandchildren in safe, walkable neighborhood parks without the risk of heat stroke. Fresh produce in Lancaster County is booming with locally sourced produce for people to have healthier options, which leads to healthier lifestyles and reduces the risk of heart disease, cancer, and stroke. Many more people are biking to work, and they're also enjoying more green space outdoors, whether they're walking their dog, or they're interacting with friends and neighbors, or they're playing with their kids. Because we have prioritized alternative transportation, and we have built our roads around the pedestrian and the cyclist. But our 80-year-old still doesn't drive, but they're able to get around and take care of the things that they need to take care of, even though they're not driving, and meet their specific needs. So as you can see, trends are not destiny. For decades, I've seen Lancaster County people and partners come together when they were challenged and achieve remarkable things. Solutions to climate change are within our reach right here in Lancaster County. One concrete example is the new Lancaster County Comprehensive Plan called Places 2040. If you have not had a chance to look at the plan, or you've not been to a session where the Lancaster County Planning Department has held an event to talk about the plan, I encourage you all to please do that. Because to me, it gives me a real good sense of hope, and it's a very practical piece of information. It provides strategies and tools that will lead us to a healthier Lancaster County. And what I would leave you with is I'd like you all to think about 20% of how someone becomes healthy happens in hospitals and health systems, 20%. The other 80% happens within our communities, where we all live, work, learn, and play. So basically what I'm saying is, you are all healthcare workers. We are all healthcare workers, and we need to work together so that we can save our very special patient, planet Earth. Thank you.